Okay.
Okay. All right. Hello, everybody. This is Muriel Smith with the St. Louis Area Diaper Bank. Welcome to my ED chat for this month. I want to welcome a very special guest is Dr. Kristen Bruno. She's with Purely Pediatrics, sorry about that, which is part of St. Louis Children's Hospital. And I asked Kristen to come on and kind of talk to us about to help parents get information about diapering their child, different resources, what questions they might want to ask their pediatrician when they take their child to the pediatrician, if they're having difficulty with, any kind of rashes or anything like that their child may have. So welcome, Kristen. Thank you for coming and talking with us today.
Thanks for having me.
So let's just start. So we're just kicking off, 2022, and we want to talk about, obviously, diaper need in the St. Louis region and how that affects families. St. Louis Area Diaper Bank partners with other organizations to help distribute diapers to families in need. But I want, Kristen, I want you to talk about sort of like some basic information that would be helpful to parents when they think about diapering their child, how often they should change the diaper, if there's certain types of diapers or materials, either using disposable diapers or cloth diapers and other things that parents might use in order to help keep their baby safe and healthy and dry.
Sure. Yeah. So first, when you leave the hospital, I definitely encourage everybody to take the diapers that they have in your basket in the hospital, because in the little bassinet that the baby's in, there's usually wipes, there's diapers, there's some extra bottles of formula that you can take. Even if you're breastfeeding, you can have those as a backup. But all of that stuff can be packed up. And so, anything you've got in the hospital, take with you, because that'll give you some extra diapers to use when you're home too. Another thing is, if you're having baby showers, if anybody at work or friends or family or anybody wants to get things for you, diapers are a great thing to give. And people don't think about that, but it's something you're going to use so much of, especially in the first couple of months of life. Having a good steady supply is really helpful. Most babies do start out in a newborn diaper in the hospital, but depending how big your baby is, you're going to find yourself moving into a size 1 relatively quickly. So I would not ask for a lot of newborn diapers, because you can always go up a little bit if you need to. So it's better if you're on the border of the newborn to 1 to just move up to the 1. Because if you try to use your newborns too long, you end up with leaking on the clothes. You end up with having to change the diaper more often because it's just not holding as well. So just one little recommendation is to not ask for a whole lot of newborn diapers. You're really going to want the next sizes up. When you leave the hospital, the baby initially will poop a lot, and it's pretty liquidy, especially if you're breastfeeding. It's a very liquid poop. It's very frequent. So you'll find yourself changing the diaper very often in the first couple of weeks of life, because there's always something in there. And the problem is that when there's something in there, it touches that really sensitive, soft newborn skin, and a rash happens pretty quickly. So newborns in the first month get red very quickly from anything in the diaper. So you end up having to change, even though there's a tiny little squirt of poop in there, you end up having to change that right away, because that will irritate the skin. So how can you help a little bit with that newborn skin? It's a good idea to use Vaseline, Aquaphor, A&D. Vaseline is by far your cheapest, easiest thing to use. You don't need to use the baby Vaseline. The regular, just adult blue cap Vaseline is fine. And keep a nice little layer on the baby's bottom all the time. That way, when the baby does poop, it doesn't get onto the skin and sit on the skin and cause a rash. Instead, there's a barrier of Vaseline there to protect the skin. So you really want to focus on protecting the skin, and then changing whenever they're wet, which again can be pretty often in the beginning. So stockpile quite a bit of diapers in the beginning if you can. As babies get older, they tend to soil their diapers less frequently. So by the time they're 3 or 4 months old, every 3 hours is fairly typical for changing. You're not having to go through a diaper an hour like you maybe are in the first couple of weeks of life. But the key thing to keeping your baby's bottom healthy is to make sure that you do have a nice barrier on there. You don't have to use Desitin. Desitin can get a little bit more expensive. It is a nice barrier ointment because it does have zinc oxide in it, which protects the skin well. But you can also use Vaseline and reserve your Desitin for maybe when things get a little bit worse. Choices of diapers. In the beginning, because the changes are so frequent, most people use the disposable diapers because there's so many changes that you have to go through. It's very hard to manage cloth diapers in the beginning. But once the baby gets older, cloth diapers may be an economical choice. It could even be something that you use maybe when you're home. And then if the baby goes to daycare, you use the disposables there. Because the cloth diapers do absorb a little bit more, especially when we're talking about pee in the diapers. A baby may be able to pee a couple of times in a cloth diaper before you actually have to change it. And then if you're choosing to launder your cloth diapers at home, that can be a considerable cost savings.
Yeah, I've never thought about using two like cloth diapers just at home and then the disposables for daycare. I think that would, and the diaper bank serves a lot of underserved families. So, our thought was always that, the disposable diapers would be the best for them to utilize. But if they can use cloth diapers at home and then use the other diapers for daycare while they're out, I think that would also assist them in some cost of having to purchase the disposable diapers, which can be very expensive to purchase, particularly in the early months when, like you said, babies are going through diapers, the newborns are going through diapers every hour probably, or sometimes more. So that's a great thing to think about, is to, have cloth diapers and disposable diapers. Can you talk a little bit more about, I guess, the number of diapers that you think, like just that a baby goes through and when they're in diapers from birth to, I guess, potty training age, and then maybe a little bit about potty training in general, like how soon should you do that? Are there signs that you can look for that your child is ready for potty training?
Yeah, we can definitely talk about that. So in the beginning, like I said, it's very frequent. The diapers are small, and if the baby poops, you really have to change it right away. Sometimes a pee diaper you can wait a little bit on. So especially at nighttime, I always tell parents, if the baby pees at nighttime, but you're getting ready to feed, you don't want to wake the baby up completely to change the diaper right then. You can wait until the next feeding and change. But if there's a poop, the poop always needs to be changed. So never ever leave a poopy diaper on a baby because it will cause a diaper rash. So always clean that as soon as you notice it, and check regularly. But I would say in the first couple of weeks, once the baby gets going with regular bowel movements, you're probably changing somewhere between 8 or 10 diapers a day. So it's a lot. And then as the time goes on, so as the baby starts to get a little bit bigger, maybe by the time you're 3 or 4 months old, you're about every 3 hours, there's a diaper change. And if the baby's in daycare, they usually check about every 3 hours. That tends to be a typical time frame, looking in between there just to check for wet. Poop, usually somebody is able to notice fairly quickly. One other thing I will add is the newborn diapers, and I believe size 1, possibly size 2, all have an indicator, a wetness indicator on them. So it's a little stripe that changes color. It changes from a yellow to a blue on the Pampers diapers when the diaper is wet. And it changes even if the diaper is just a tiny bit wet. So if you are hyper vigilant and watching for those little lines to change all the time, in the beginning, you will probably change more diapers than if you were looking for a diaper to be more soaked, because it does change even when there's just a little bit of dampness on there. So just kind of be wary of that. As the babies get older, you don't have those indicator lines anymore because you can tell when the diaper is wet versus not because they get heavier. As kids get older, again, less and less diaper changes. Most kids will, by the time they're toddler ages, will probably poop 2 or 3 times a day and maybe pee somewhere in the range of, every 3 to 4 hours. So kind of like the same pattern that we would have if we were hydrating ourselves well. So that's about how often you plan to change the diapers. Once kids start sleeping through the night, you don't change overnight time. So most children will not wake up overnight wet because they're also not eating overnight. So if they're not taking a bottle every 3 hours overnight, they're not going to make a wet diaper every 3 hours overnight either. So once the sleeping through the night starts happening, which can be for some babies anytime after 2 or 3 months of age, you've got less diapers overnight, more of your diapers will be during the day. So that cuts back on some of it too. If your baby ever does wake up in the middle of the night, though, with a poopy diaper, definitely change that. That's not something you ever want to leave because, again, just the rash risk. Of course, they rarely wake up in the middle of the night. Hopefully, for most of us, most are sleeping to 12 hours at night. So that's 11 to 12 hours where you're not changing a diaper. So at that point, you might be somewhere in the range of, maybe 4 or 5 diapers a day on a toddler. So a lot less than you were before. When you're looking for readiness for potty training, most kids potty train somewhere between about 2 and 3.5 years of age. 2 is probably on the younger side. 4.5 is your older side of things. What you're watching for is readiness. So when the child is letting you know that he has a poopy or a wet diaper and wants you to take it off, wants you to change it, is starting to kind of go off into a corner to poop, sort of looking for privacy, even though he's still using the diaper for it, then you're starting to have some readiness for potty training. And it's a good time to just get a potty out, either one of the little potties that the child can sit on, or put a seat with a little step stool for your potty, and just encourage the child to go and use the potty whenever they let you know that they've pooped or peed. So even though they've already gone, you're still going to say, okay, let's go into the bathroom. We'll sort of try again. So just start associating that. And then picking times during the day that are common times for a child to pee or poop, which would be when they first get up in the morning. Most people, children included, will use the bathroom as soon as they wake. So if you're potty training a child, as soon as they wake in the morning, take them into the bathroom and have them sit on the potty. And then before and after nap time, before bath, before bed, those are kind of your key times to look for when you get started with it. And remember, if the child does sit on the potty, even if they don't do anything in the potty, lots of praise. So lots of positive reinforcement for the action. And then, of course, if they actually do something, then you're going to up your reinforcement even more.
Right. Yeah, I remember all of those things when my kids were little too.
The other thing with potty training is, once kids are getting closer to potty training, you can actually kind of skip the pull-up phase. Pull-ups are very expensive. Very expensive. I think they're twice as expensive as the diapers. You get fewer in the packs, and you'll notice as your child gets bigger, the packs of diapers get smaller. And that is because toddlers use less diapers than newborns do. So you won't see as many diapers per pack as the kids get older for the same reason. But once they start potty training, once they're at the point where they're actually using the potty on a regular basis during the day, just put them in underwear. And if there's an accident, wash the underwear instead of going into the pull-ups. Pull-ups tend to be a bit of a crutch. So toddlers are more likely to pee or poop in a pull-up than they are in a pair of underwear that they really are excited about, a Scooby-Doo underwear or princess underwear or whatever it is. Less likely to soil those than they are to actually soil. They're less likely to soil those than they are to soil a pull-up. And you don't want to end up going through pull-ups all day long. So if your child isn't quite ready for underwear, have them in diapers. They work the same way. You don't have to go into the pull-up phase.
Yeah, that's good to know. And we have both. So we distribute both diapers and pull-ups, so very few pull-ups. So we do have some of our partners that utilize those, but I know even, for families, the ones that they get, through our partners, that's not enough if they're trying to potty train. So it's good for, for them to know to sort of how they can use less pull-ups, they can continue using the diapers, or, the underwear that can help them sort of get out of the diaper phase and out of the, using pull-ups, that'll be more economical for them and help them with, having to purchase those things. We kind of go with the number of diapers that we give or that we recommend are given to families, just kind of based on some research that was done. And so I want to ask you to make sure that we're, giving the right amount that's going to help families, either with daycare, at home with diapers. So for the younger babies, birth to 2 months, we recommend 75 diapers for them. So our partners will give those families 75 diapers. And for the kids that are the babies that are 3 months or older, are in size, these are sizes, newborn is size 2, and then size 3 and up, we recommend 50 diapers, and we're giving those per month to families. Is that a good amount to help sort of, I know it's not helping their full need, but is that, are those amounts going to help families that are in need, help with their diaper need in general?
Yeah, I think it should be a huge help with it. If you think about the size 3s and up, you're looking at, depending on how big the child is. That's the other thing. There are some larger babies at 4 months old that are wearing size 3s, and so 50 diapers may not be enough for that size. Going based on the age of the child might be a little bit more accurate than going on the size of the diapers, because the size of the diapers doesn't match well with the age, unfortunately, because sometimes you have a 1-year-old that's in a size 5, which is a big 1-year-old. Yeah. So it just kind of depends on the age of the child. But I still think that 75 diapers for sure in those first few months of life, a month is a huge help. You're covering, if you think about, they're probably at maybe 8 to 10 changes a day in the first 2 weeks. And then after that, probably somewhere around 8, if the baby's sleeping a little bit at nighttime, then you're getting at least a couple of full weeks a month that you're giving when you give 75 diapers.
Right. Well, that's good to hear.
And meeting half of a need is still huge.
Right. Yeah. Well, thank you. That's good to hear. Do you, I guess, when you're seeing families, do you see a lot of families that struggle with, health things that have to do with babies because they haven't been changing the diapers as often, like either diaper rash or, a urinary tract infection or something like that?
Yeah, so probably diaper rash more than anything. And diaper rash can happen even if you're really careful. I will say I probably see diaper rash a little bit more with children that go to daycare and other caregivers. And this is not to say that they're not being changed frequently enough at the daycares, but I think sometimes when infants are home, they get changed a little bit more often, and so they just don't get as many diaper rashes. And then the parents know their routine. They have their Vaseline on there all the time. They're wiping carefully. So they're really hyper vigilant about it. So I probably see a little bit more diaper rash when kids are in a larger daycare setting. And it's just because, especially if they're a little bit older and they're playing, maybe nobody realized that the baby had a poopy diaper at the time, or something happened. The other thing is that, when kids have diarrhea, which happens more when kids are in daycare just because they're exposed to illnesses, that's usually when a diaper rash happens, because diarrhea, your poop is a lot more frequent. It's very watery, and it will definitely irritate the skin. So whenever they have any kind of stomach virus, you're going to see diaper rash happen with it. So when kids do have a stomach virus, one of the most important things parents can do is really up their diaper changes, and then be extra careful with their care. But diaper rash is a very common problem in young infants, and it happens until they're out of diapers. It's less of a problem as they get a little bit older, but certainly still when everything is pretty loose and liquidy in the first 6 months, it's a problem for most infants. So using a good barrier ointment on the bottom all the time with diaper changes is very important. And again, like I said before, it doesn't have to be Desitin. I think Desitin is good to use once you get into the place where you have kind of a diaper rash you have to treat. But prevention can make a huge difference. So if you just put a little bit of that Vaseline on the bottom all the time, keep that nice barrier on there, and then change your diapers often, you're less likely to end up with rash issues. If you do end up with a diaper rash, most of your pediatricians will give you advice over the phone on it. If it's not getting better in a couple of days, then usually we want to take a look at it. But a lot of times it's phone advice for diaper rashes. Although we still see plenty of little ones in the office with it too. But what's important with diaper rash care is airtime. So getting the diaper off. And this can be hard, especially with a really young infant, because if you take the diaper off, it's very likely that young infant is going to pee or poop everywhere. But getting the diaper off for some airtime is really important. So what I tell parents to do is take the diaper off right after they have had a bowel movement or they've peed. And then give them about 15-20 minutes of just airtime. With a young infant, I'll have them just lay them on, do that tummy time on a towel. So something that can be just washed easily. That way, if they do eliminate at that point, they're getting onto a towel. It's not going to get everywhere. But definitely the airtime and getting that diaper off and allowing that airtime to happen several times a day really helps the diaper area, the bottom, heal up. And then the other thing when a diaper rash happens is making sure doing some baking soda baths. So just 1/4 cup of baking soda in a warm bathtub. And you just let the infant kind of sit in the bathtub for a few minutes and just kind of soak. It's almost the equivalent of like a sitz bath, just soothes the skin. So that can really help. So airtime plus the baking soda bath. And then using a really good diaper ointment on top of that whenever there is a bad rash. One thing that's helpful with diaper ointments is when you apply the diaper ointment, make sure that parents are not trying to wipe it all the way down to the skin. This will do two things, right? One, it will save, excuse me, hold on one second, Rosie. It will save the amount of diaper ointment that you're using, because if you're not wiping it completely off every time and then reapplying a full amount every time, you're saving some diaper ointment, which Desitin can get a little pricey. But the other thing is that you're saving the skin, because diaper ointment, Desitin, Boudreaux's butt paste, any of those, they're intended to really adhere to the skin well. That's how it provides a barrier. And so if the diaper ointment is stuck well to the skin, then there's no poop touching the skin, because it will just get on top of the diaper ointment. It gets onto the barrier and it doesn't actually get under the skin. The other thing is that it's very hard to wipe off all of the ointment, because it does adhere to the skin so well. Vaseline is pretty easy to wipe off. You can get that off easily. But when you're really using a good thick diaper ointment to try to clear up a rash, that ointment is sticking to the skin well. So you can help out the skin by just clearing off the diaper ointment that's dirty. So I tell parents, just kind of wipe off whatever got soiled, but don't try to get your skin to show at that point. We don't need to get you to wipe off every last little bit of Desitin so that you can see the skin. Just wipe off what's got dirty and then reapply a little bit extra. And that will save the rubbing on the skin, which tends to make things hurt even more.
Yeah, those are good thoughts. What are your thoughts around using wipes? Is it good, or is it best to use like tissue paper or just a rag?
No, wipes are great when there's not a rash. When babies do get a diaper rash, then I do recommend parents to either use the water wipes. They make a water wipe now, or what they can do, you don't have to go out and buy fancy wipes. You don't have to buy the water wipes. If you don't have the water wipes available, just use a wet washcloth and kind of clean off that way. All right. That way you're not irritating the skin with a diaper wipe when the skin is already irritated.
Right. Yeah, those are good points. We don't offer wipes here yet at the diaper bank, but we get a lot of requests for those from our partners. So I know those, along with diapers, can be expensive. So I think letting our parents or our families that receive the diapers know that they can use a washcloth, which I'm sure is, they have those available. And that's, no cost or little cost, unlike the wipes. So that's a good information for us to pass along to our partners so that they can let the parents know that that's another way that they can, save money.
Mm-hmm. And really save the skin too, because some of
Yeah.
the wipes can be a little irritating on the skin anyway. So when the skin is broken down, when there is a diaper rash, we always have parents go to just washcloths and warm water, or even just kind of running the baby's bottom underneath the sink to clean off the bottom, just so that we don't do any harsh rubbing on the bottom. So not only does it save on the pocket, but it probably saves the baby's skin a little bit too if you use a washcloth now and then.
Yeah, that's great. Well, is there any other words of wisdom or things that you'd like to, say before we end to help out parents?
I think those are the main things. And then, what I would encourage parents to do, if you are running low on something, reach out and ask. I mean, there are agencies like the Diaper Bank. WIC, I know, will provide formula. I don't believe they provide diapers, but sometimes, as your child gets older, sometimes insurance companies can cover some of that. So always ask about that. The other thing would be, reaching out just in Facebook groups, because you'd be surprised how many people just have, boxes of diapers that they don't need, because let's say they did have a baby shower and they got too many boxes of size 1s and they have a baby that's in a size 2. Well, those size 1s are now useless. So there are people giving away diapers all the time. So if you're low on something, just reach out and ask, putting a post in a mom's group, hey, does anybody have any size 1s that they need to get rid of? I'm really looking for some, can be very helpful. Right. So I would reach out into your community, especially these mom group communities, because there's a lot of resources there that people don't realize are there.
Right. Yeah. Those, I never thought about that. To have tell parents that they can reach out on Facebook, yeah, to get additional extra diapers. We actually do get families who either their child is out of that size, or they specifically had a first birthday party where they just got donations in. So we do get those and for their baby grew out of that size, and we get those donations. So that's a good tip to have, to tell parents that they can also do that. Just reach out to their Facebook community and to get, extra diapers as well.
Yeah, and pass them on. The other thing to remember is if you did get a lot of diapers that you don't need, reach out for the same reason and say, hey, I've got some diapers. Anybody want to trade? Right. I've got borns that I don't need anymore. Does anybody have any 1s they don't need? Or anybody had, I think it's because there's probably is a lot of waste where people just go, oh, well, I don't need any more of these. I'll just toss them. There's a lot of diapers out there that can be passed on to somebody that needs them.
Right. Great. Well, thank you, Kristen, Dr. Kristen, for joining me today for our ED chat. I appreciate that. You gave lots of good information that I'm sure families and parents out there will appreciate and be able to follow. So thank you again for coming and joining me today for the ED chat. And you have a good day, and we'll see you everybody else later.
Thank you so much for having me, Muriel. Bye, everyone.
Bye.